Good morning, I'm Mike Powers. A lot more people in this class than the previous class. Imagine everybody had a good night. Today we're here to talk about some soft skills and not really technical stuff, but how to get along with your team, maybe how to be a little bit better leader. And this is just something that I find personally very important, especially as we're seeing so much turnover in the industry, lots of new faces coming in. How do we go about addressing some of the talent turnover that we're experiencing? So I am Mike Powers. For those on the recording, I'm a middle-aged guy. I'm wearing blue pants to blue shirt. I'm a clinical engineering director at Intermountain Health, which is kind of the north half of the Mountain West in the US. We have 33 hospitals currently and 500 clinics. That gives us about 200,000 medical devices. Territories cover Nevada, Utah, Idaho, Montana, Wyoming, Colorado. We do have subsidiaries all everywhere from New Hampshire to New Mexico, and maybe even soon something on the Pacific coast. My portfolio is field service. So not your high volume, lower complexity devices that are in the facilities, but your capital equipment that you just don't have enough of on any particular one site to permanently station somewhere there. So I've got a team, almost 50 people that drive around in vans all day long and go to the different sites to provide services to the equipment so that the equipment is accessible for the caregivers so they can take care of our patients. To talk a little bit about where soft skills can come from. It's my thoughts on leadership and management. So I always put this slide in every slide so you get to have it too. And then kind of the meat of this discussion is going to be generations. Now, as they say, we're currently experiencing a gray wave in HTM, and that Amy has come out and said between 2020 and 2025, 50% of the workforce is going to retire. 50%. 75% of the leadership is going to retire. So with this mass exodus into retirement, how does that impact day-to-day operations? How does it impact knowledge transfer? How does it impact, well, just how you talk to folks, right? So why do we need soft skills? Well, if we can't communicate, then we really have a hard time accomplishing our roles. Most of the nurse managers I've ever talked to have said, gosh, Mike, you know, the device can be broken an additional day. It can take longer to fix if we just know what's going on so we can plan for it, right? So making your service provider an integral part of that caregiver's experience so that they can then go on to provide care for our patients, right? I like to say that modern medicine is really kind of like this easel, right? It's got 3 legs, and the 3 legs are the patients, the caregivers that take care of them, and then the medical equipment that the caregivers need for the patients. Well, here at MD Expo, most of us are HTM professionals, and we support this whole 3rd leg of modern medicine. Without it, it just kind of goes away and loses all stability. So that's who we are and what we're doing, and that's kind of why we do it. But the ability to communicate with each other, to pass on 40 years of experience, got a fellow that's getting ready to retire, and he remembers when they were in the building and just knows where the conduit is in all the rooms. That kind of knowledge just is irreplaceable. So to have somebody who can walk through with their relief and say, hey, look, I know you're going to take this department over when I retire. Conduits are always 2 foot off the north wall on the east side, right? Just those kinds of things that enable service to be performed efficiently. And the other thing I think is important with soft skills is marketing. You should market yourself. You should market your department. You should market your company. If you're a third party company, right? If you're a manufacturer, you should market yourself. So when good things are happening out there, even when bad things are happening, you want to make sure all the stakeholders know. And whether those stakeholders are department heads, whether stakeholders are finance, purchasing, whether they are, gosh, whether they're the patients, right? We want to be able to communicate what's going on, maybe flag a little bit. Golly, we're doing a great job. This is how many PMs we did. This is our environment of care report, right? These are some of the great things we're doing. But if nobody knows, nobody knows. And then all of a sudden you'll have a CEO that goes to a conference. Maybe it's American Hospital Association, but a conference, and all of a sudden they get to go play a game of golf with somebody who wants to say, you know, maybe we could do taking care of your equipment better than your team does. If you've got an email sitting in that person's inbox saying, hey, this is how many great things we did, maybe that's an opportunity for you to compete and adopt that best practice that so many service providers do now, to market yourself with quarterly business reports and holding yourself accountable. So soft skills, why? A little bit of marketing, a little bit of communication, a little bit of the ability to pass on some of that knowledge as we've gone through the years. Oh, totally. I would definitely say that. So you're not just trying to fix the device, but you're trying to fix the caregiver's relationship with the device. And then, you know, with other departments, maybe they're trying to hoard all the infusion pumps and you have to use your RTLS to go, look, it's here in the drawer. We got to get this back out into production, right? So, yeah. Oh, his question was, does communication also help address friction between departments and offer opportunities to address, you know, poor performance, and maybe a surgeon who says, golly, why can't my because I can't perform surgery without this device, and so I'm just not getting paid. And that's a really key factor there, right? So how do we address some of those conflict as well? How do we get this? I think really the two ways to find people with great soft skills are you either hire them that way, or so there's an opportunity to hire a lot of new folks right now as we do go through replacing 50% of the workforce by 2025. That's a lot of folks coming in the door. How do we make sure they're the right folks? I mean, I've learned over the years that I can teach just about anybody to fix something, but I can't teach them to be nice. And I can't teach them to give a hoot. So when I hire, I try to look for people that are nice and people that give a hoot, people who can express themselves. So sometimes you might have a person who they can talk your ears off, but if you ask them to document it, hey, write down what you did in your work order. Nope. So you want somebody who can also not only communicate well, spoken word, but also written word. Some strategies for that. Well, I ask a lot of, tell me about a time questions when I'm doing an interview. I might even try and put somebody under a little bit of stress during an interview. One of my favorite questions I was ever asked was about 2/3 of the way through, a fellow looked at me and said, I really appreciate that you came all the way down here for this, but what if I told you you're just doing horrible? and I just kind of froze up and went, well, golly, I don't know. I guess I got to thank you for your time, but then I'd like some feedback. If you're telling me I'm doing horrible, what's the feedback? Why am I doing horrible? What should I have done differently? So at least I can make a learning experience. So you're actually doing fine. That's just, I wanted it to not be you clammed up and froze and walked out, or stormed out, or got mad and yelled. let's do something with that feedback, right? So soft skills. How, well, how do we make sure that we're choosing our interview questions the right way? And then as someone conducting an interview, document all of that. Write down what folks say. And then evaluate them on the same set of questions, the same, let's now look at their answers and evaluate them. This person had the best answer for question 1. Maybe somebody else had the best question for question 2, and weight it and figure it out so that it's reproducible. Don't just wing it. But yes, in your interviews, you can actually filter for soft skills, and then look for things like follow-up. Do they write you a thank you note? Do they email you at least a thank you note? Do they just walk off into the sunset, you never hear from them again? Written communication is important as well. If you can't hire them, and you've got all your folks now, let's develop them. So I've got several very new to leadership managers, and one of the things that I always have them take is a class that we have called Crucial Conversations. And it helps you address things like, how do you tell one of your employees that they're the stinky person? That's one of those discussions that, hey, everybody has at least once in their career. Stop and focus on the problem, not the person. Hey, make sure that you're not saying somebody is, this is a you problem. No, this is a problem. You're actually a person with some value, but this problem we can address and we can remedy. So teaching, developing folks so that they understand how to work through some of those difficult conversations. Doesn't have to be confined to leadership. You can take your new caregivers and say, you know what, I'm going to go talk to the department head and tell them that the machine's going to be down until next week because the parts are coming from the Philippines and they're on a boat that's held up at the Panama Canal because there's no rain. And the Panama Canal has a 3-month backlog for parts coming from Asia, right? So it stinks, but we can't get parts, we can't get fixed. I'm going to go talk to the leader. Let's take that new caregiver with you so they can see some of that conversation. They can experience it, and they can maybe participate. Maybe they're the person who's troubleshot it and said, look, I really am waiting on that board. We're just waiting for it to be delivered. And they have the opportunity to grow. Also, when you're having your staff meetings, I've noticed in this field, there are a lot of introverts who don't really want to talk and jump out. So usually in a staff meeting, I'll see that I've got the same 3 people. I want to talk about it. I want to address it. I want to do whatever. And the rest of my team just doesn't say much. If you talk to your team on Monday for Tuesday's meeting and say, hey, look, tomorrow, these are the 3 big things we're going to talk about. And I know you're the kind of person that likes to, noodle on it overnight. So you think of what you want to say and make sure you say it the right way. Then that way you're helping somebody who maybe doesn't have the soft skills to play it off the cuff. You're helping them to prepare. And then all of a sudden you can get all of the ideas from all of your team on how to address maybe that issue, as opposed to just the same 3 loud people who always raise their hand. So work with your team. Different folks have different styles of communication. They have different styles of what gives them energy, introvert versus extrovert, right? So addressing soft skills allows you to work with people where they're at, not where maybe you want them to be. I love talking about leadership and management. It's a personal mission of mine. As a leader, when you're trying to develop these people, when you're trying to hire the right people, you're kind of there to be the riverbed, right? You want to hold them up. You want to give them the guidance. You want to remove the obstacles so they can be successful, but you don't want to have intrusive leadership. what we're calling micromanagement nowadays, intrusive leadership. Your team should be the stars, and they should get all the credit. You should kind of be maybe the umbrella to keep it from raining on their head on a tough day. If they can give you the feedback, hey, look, machine's going to be broken an extra day. I'm scared to go tell the department head. You come with me? Heck yeah. Go. We've troubleshot it. We know what's going on, but parts just aren't here. They're stuck in the Panama Canal. How do we deal with that? So, as a leader, your role is to guide your team, remove the obstacles to their success, but not to steal their thunder, and really maybe protect them if it wants to rain on their head. Managers, on the other hand, well, managers manage things. They don't manage people. They manage things. You can manage a budget. You can manage an inventory. But you can't manage a person. You can lead a person. If you're trying to manage people, well, you might be the kind of leader that they had at the start of the last century. We're trying to get everybody to do the same job the same way like they're a robot. We're not accounting for some of the individual components that allow them to be just shining stars. And why do I need my introverts to speak up in a staff meeting? Well, they've got great ideas and great experience, and we might be able to fix it twice as fast if I can get everybody thinking and working on the project. If I've only got 3 people, I'm only using 3/8 of my brain power, right? You lead people, you manage things. Communication. You gotta stop and look at your team and make sure that they're being advocated for, as well as thanked. And that's one of those interview questions I like to ask is, how do you like to be appreciated? Some people, they want a handshake in the hall and a thanks. Some people want a tiara and a parade and balloons and front of the class, big plaque. Yes, not everybody's like that. So understanding how your team wants to be recognized, communicate about that. You have to ask. If you don't know, you can't give them what they need. I think that a lot of times when somebody is having a hard time with their leader, and they say that like 50% of people that leave a job leave because of leadership. So a lot of times people are having a hard time with their leader. It might be something around expectations. So unmet expectations can lead to resentments. So if everybody is communicating what your expectations are, how do we fix the device? How do we document we fix the device from current to proper operation? How do we make sure that we talk to the end user so they know what's going on? So you talk to the person who called it in. What if they're not there? Talk to their leader. What if they're not there? Leave a note. What if you forgot to reboot it? We'll make it a habit the next day. Always call and say, I'm just calling to check, is it still fixed? Who's had somebody, the machine is broken the next morning because it didn't reboot correctly, and all of a sudden the end user is trying to place a new service call, and it takes 4 more hours, 6 more hours to get somebody on site. If you fix the device and you call them in the morning and you say, is it still fixed? And they go, actually, no, it didn't reboot today. No 6-hour delay. That communication leads to much higher job satisfaction, much higher opportunities for the devices to be available for patient care, access to care. This isn't really always all about the caregiver or the teammate. It's because in this industry, we're here to be that third leg. We're here to facilitate care for our patients, for our neighbors, right, in our communities. Mike, where do you get all this? So there's a book written by Robert Greenleaf called Servant Leadership. It's one of the ones that I love. I make sure that all of my leaders get a copy. It's, 50 pages or so. It's pretty easy. If you have a hard time sleeping at night, it can help. But if you're looking for a short book on leadership, Robert Greenleaf's Servant Leadership really does touch on a lot of those topics and says, as a leader, you're really there to be the advocate and the guiding force for your team, not to steal all the recognition, not to yell at somebody when they mess up in public, Praise in public, punish in private. All these things in this book. Great book. So thinking about different generations in the workforce. What about your day? You wake up in the morning and go to the gym. You wouldn't know it, but my doctor yelled at me in January, and I've been going to the gym. What time do you go to work? Some of us are 5:30 in the morning folks. Some people, maybe they work in a department that it's hard to get into, and they know they're only going to be able to go work at 5 o'clock. It probably takes 4 hours to fix something. Wandering by 11. So what time do you go to work? Do you wear a tie? I have an organization that tells us don't wear a tie. It makes you unapproachable. People can come up and talk to you a lot more if all of a sudden you're not a stuffed shirt with a tie and a pocket square. Still wear loud socks, but we all have all those things. What about your parents? Do they wake up and go to work at the same time? Do they wear a tie? What, maybe if you've got kids, do they do that? Do they wake up at the same time? Do they go to work out in the morning? My daughter doesn't. She works out at 7 o'clock at night. I have no idea how. At the end of the day, I'm always wiped out. But everybody does things differently. Kind of, well, part of it's generational. So in 2024, 12,000 people per day will turn 65. And that's going to continue through 2027. This is the absolute peak of the baby boom. The 2024 to 2027, 12,000 people, I think it caps at almost 13, be just under 13,000 per day will turn 65. Goodness, that's a lot of folks. That's a silver tsunami they're talking about. 50% of people are going to be retiring from the workforce by 2025. What else is that going to impact? I bet it impacts reimbursements. Everybody says healthcare, we're struggling for money right now. Why? Well, 12,000 people a day are switching from private health insurance to Medicare. Medicare doesn't reimburse at the same rates private insurance does. Suddenly, as an organization, treating the exact same patients as you treated yesterday, now you're going to make a fraction of what you made yesterday for that service because now you're getting reimbursed by Medicare as opposed to a private health insurance that employer pays. Where is this going to bite us? One of the things I've found as an unintended consequence is policy. We've got a lot of people that have been doing this for 40, 42, 45 years, and they kind of know how to make it happen. They know how to fix the equipment, they know how to document it, they know how to make it happen. But if I followed them every day and asked, are you doing everything by the book? Maybe there's some gray. Maybe we've got a policy on purchase orders. How do you get a purchase order? Well, you get a purchase order from purchasing. Everybody has to sign off on it, and then you can call in a vendor maybe to get the work done. What if there's a broken machine at 11:30 at night, there's cases tomorrow morning, and purchasing closed at 5? Maybe that person issues a PO that says it's 4.7.24.MP. That's my PO number. And gets the service provider in to provide the service so that the following day, the device is available for patient care. 4.7.24.MP is not a PO number for my organization. But that person who's been doing this for 45 years might know, how do we work around that policy? Well, you shouldn't have to work around your policies. Your policies should actually work. So one of the things I'm finding is we've had people doing this stuff for years and actually violating policies. And that's not what we're trying to do here. So I hired new people and they try and do it by the book and they fail miserably and things don't work the next day because I couldn't call anybody in, purchasing was closed. How do we, well, let's just fix the policy. Let's write a policy that says this is how we do it. Let's have some standing POs, all our major vendors, so that we can provide a standing PO number that works. Simple. But we don't know that if nobody ever said, hey, Mike, Been doing this for 40 years. There's no PO numbers at night. How do we address that? Because it's can-do attitude. We're going to fix it. We're going to take care of it. We're going to help that patient, help those caregivers that are taking care of the patients. By golly, we're going to help. Well, as they head off into retirement, we're discovering things like policies are needing to be modified to address things like purchase orders, because new people are following the policies and it's not leading to the right outcome. Yeah, man. The conversations? Compensation. I did not say compensation. Oh, I said Medicare tends to compensate organizations on a fee-for-service basis a little less than private health insurance does. I think that there are a lot of healthcare organizations who are looking for ways to save money, and life cycle management of capital equipment is one of those ways. So are there efficiencies that can be driven into the system? Yes. Do I think that's going to impact how much people are paying for certain services or products or whatever? I'm not qualified to say. But I do think that if I have Mrs. Jones coming in one day and she's got private health insurance and she has something done, and she comes back tomorrow and she's now 65 and she's on Medicare, she has the same thing done a second time, most likely I'm going to see less revenue from Mrs. Jones in the second day. Now, if it's a return visit with HCAP and stuff, you're probably not getting paid for the return visit anyway. But the idea being, generally, Medicare pays a little bit less than private insurance. They're looking out for your tax dollars. They're making sure that we're seeing some value in healthcare. What is it? I read the other day that 1/4 of all of the money spent on healthcare is on stuff that doesn't lead to better outcomes. We could reduce the cost of healthcare by 25%. And that's like $4 trillion we spend on healthcare a year. So $1 trillion we could cut out of it. That's a lot. So how do we get there? And knowing that there's going to be less compensation coming in the door, knowing that organizations are going to have to look for those value adds, taking care of the equipment, that's one of those value adds. Whether you're a manufacturer, or whether you're an in-house shop or somebody else, you have to look for those opportunities to drive value into the equation. And I think that's something that we can probably all agree on, right? Generations in the workplace. SHRM, Society for HR, says that these are the 5 generations. You have traditionalists, are going to be over 76 currently. Baby boomers, those 57 to 75. So think like the greatest generation, the World War II generation, and then their children, right? And then Gen X, 41 to 56 currently. Millennials, you probably heard about them a little bit. In fact, this year, millennials are overtaking baby boomers as the largest demographic in the workforce nationwide, not just in healthcare. And then Gen Z, those that are under 25. These are kind of the buckets of people that are out there. And I'm going to make some generalizations as we go on. So generalizations are just that. They don't apply in every instance, but maybe a blueprint for consideration. So how do people think about their employer? Well, the World War II generation, the traditionalists, they're going to be loyal to their company, right? They're going to probably have a pension. They're going to have done this for a long time and believe that the company is going to take care of them. Baby boomers have seen too much of that not working. They've seen that their parents got let go with a pink slip after 35 years at GM and they didn't get their retirement. So they pressed for things like 401ks. I want to be able to take my retirement with me. Do I trust my organization? Yeah, We can be loyal to the organization, but more so loyal to the team. People I work with, we want to make sure that we're doing the best we can together. Maybe go the extra mile personally to help the people you work with. So Gen X, not going to be quite as much of an organization-based group. They're going to like their leader a lot, but are they going to be so much focused on pensions and 40 years at one employer? Maybe not so much, because they're seeing that didn't really work, and they're seeing that their parents, baby boomers, probably didn't experience as many great things as they wanted. So how do we go about addressing that? So their response was to be loyal to their manager, maybe exceed expectations, deliver some results that are going to help their career. Millennials, they love their colleagues. So you'll see with millennials that if a bunch of folks quit on one day, everybody else that hates the company might quit on that day too. So there's a lot of that colleague mentality. We're all gonna vote to unionize Starbucks, we'll do it together. So there's a real esprit de corps with millennials. They believe in equitable treatment. Probably seen a lot of rise in D&I programs, diversity and inclusion programs, mostly driven by millennials. Want to see everybody get a fair shake, right? And then Gen Z, careers are important, but man, it's more about the experience. Do I feel like I'm contributing? I feel like I'm the one that's giving back and I'm appreciated. Again, kind of generalizations, but we have to talk about each group of folks. This might be some ways to consider each one of these groups of folks thinks about themselves and each other and where they get value in the workplace. So how's that going to impact how you communicate with them? If only there was a slide on it. Perceiving authority. So the greatest generation, World War II folks, traditionalists, probably had some of those jobs where they were Rosie the Riveter. They were trying to be a robot and were managed like robots to do the same job for each day for 40 years. Tell me what I should do. I'll do it. Baby boomers think that they should challenge authority a little bit. Maybe the 1969 Woodstock, want to challenge authority a little bit. Maybe they like flat organizations, a little more democracy, and they want to show you what they can do. I think back to the 80s. I want to show you what I can do, right? Gen Z wasn't impressed by authority. So there's a little bit more rebellion, a little bit more ennui, just kind of, I don't really believe it. Not sure that you looked out for my parents or my grandparents. So instead, I want you to tell me what you can do for me. Authority, tell me what you can do for me. How can you help me out? Millennials, well, a little bit more of that timeliness, right? So it's show me what you can do for me, but not just what you can do for me. Show me what you can do for me now. I've watched mom and dad do something because of tomorrow it was going to be great, but show me what you can do for me right now, because I need to decide if this is working for me. And then Gen Z, they're collaborative. They, you know what? If we're going to all unionize Starbucks, we'll walk out together. What can we do together? Not what you can do for me, but what can we do together? How can we collaborate to make this a better thing? Well, if we had the notes of what we're going to talk about tomorrow, maybe we could participate in the team meeting and help to come up with better solutions for that problem that we're trying to do with that project, right? But if I'm an introvert and I don't know what we're going to talk about tomorrow, then I can't tell you what we're going to do together because you're going to spring it on me at the last minute, and then, well, I don't want to raise my hand. So what can we do together? How do different groups perceive authority? Be authoritative, be a manager, be authoritative. Heck no, you're a leader. So you might figure out where I fit on this by that response. Working styles. Greatest generation, the traditionalists, linear. Remember I said this is the folks that might have been Rosie the Riveter. They might have literally done the same job every day for 40 years. You should only really change things if it's broken, it doesn't work. Deming came from this group, guy that's kind of an inspiration for quality management systems and Lean Six Sigma and all of that. He was a traditionalist. Let's fix it when it's broke. Well, it's all broke. Let's fix it and drive some efficiency into it. Baby boomers, they kind of structure, they challenge the rules a little bit, kind of cautious with change. You do burn everything to the ground and nothing's going to work. So they wanted some change. They want it to be better, but little bits at a time, baby steps. Gen Z, flexible. Let's change it right now if we have the opportunity, and let's make it better. We can do this. We can make it better. Let's do it. Millennials expect to create the rules themselves with change is going to be improvement. So they want to have a voice. So you have that team meeting, right? You say, look, we're trying to accomplish this thing. We're going to build, a new set of ORs. We need somebody to run the boom project. We have somebody who can step up and make sure that we have the right medical gases in all of our booms. Yeah, that's who wants to do it. They want to help create what tomorrow looks like. Gen Z, collaborative again, agile, they want balance. They just kind of see change as a everyday thing and it's part of reality. So that, the only thing that is constant is change. Gen Z really embodies that. So they expect it, they know it's going to be part of things. That means that they may not stay with your organization forever. What about training? It takes a lot of resources to train somebody. What if you invest in them and they leave? Well, what if you don't invest in them and they stay? So kind of thinking about how different generations are going to approach authority, how they're going to approach change, how they're going to deal with the new CMMS, and making sure that you stop and you address some of those concerns, that if you have a problem and you can get your team to help provide the solution. Set it up so they say, hey, I really wish that we had a solution that looked like A, B, and C. Well, then when you develop the solution and it includes A and B, then they had a voice in that, and they're going to be a lot more buy-in, and they're going to be change agents. They're going to have some ownership of that, as opposed to just, we'll fix it if it's broken, right?
What about like so-called practices, for instance, you're talking about training.
Mm-hmm.
So if you send somebody to RTI, right?
Mm-hmm.
And you make them sign a paper where they say you'll stay here for the next 2 or 3 years.
Mm-hmm.
You believe in that? You think that's okay?
Have you ever heard the expression that locks keep the honest people honest? My experience with contracts like that has been that it usually costs more in legal fees to enforce them than they're worth. So for RSTI, those type classes, maybe it's $10,000 a week, and you'd love to see that investment recouped. But a lot of healthcare organizations, when they do the math and they actually look at what does our legal team cost per hour and how many hours of work we have to devote to enforcing that contract, maybe all you're really going to get out of the contract is you get to withhold their last check. So it keeps honest people honest. Does it really add a lot of teeth to it? If they walk, are you going to take them to court? I would wager that the answer is actually no. Not because it's not worth it, not because people shouldn't do what they say, but just the realities of the expenses of taking someone to court. We do work in an environment where reimbursement structures are changing. Lots of folks are retiring, less revenue going into healthcare organizations. We have to look for those opportunities to save money, and going after one employee because they went to training, it might be a diminishing returns. It is at my company. Every company is a little bit different. So let's talk about communication. We advertise this as communication class, right? So everybody's an individual. A lot of these are generalities that I've been saying. Maybe biases is a good word. Some biases are really great. If you have a bias that says when you're driving down the road and the car in front of you has red lights on it, you should probably stop. Really good bias to have. If you have a bias that says, I don't know, people over a certain age shouldn't do something. Well, maybe that bias is limiting. Maybe you're losing out on a lot of experience and a lot of knowledge that way. Maybe you're losing out on the opportunity to do something better. So biases can be both good and bad, but be aware of your own. We're here talking about some of the general trends with generations. Think about baby boomers. They started their careers typing up letters. You know what? They would go to a place and knock on the door and come in and say, I see the help wanted sign on the window. I'd like to apply for it. Here's my resume. Might like face-to-face meetings. Didn't have the technology for other stuff growing up, right? So if you think about how technology goes through and it impacts communication style, you'll see this over and over again, prefers phone calls, audio phone calls, not FaceTime phone calls, and is very comfortable with those. Studies show that 93% of baby boomers use email consistently as well. Phone calls and then maybe email for those that are currently the baby boomers. More technological, the communication channel like Zoom or Teams, as those have come into the business world, like during COVID, this generation was forced to really adapt and try and embrace that, and there was some struggles. People that just weren't able to make that step, or if they were, it wasn't a comfortable step. Well, now we're even seeing things like FaceTime on your phone. Hey, show me what you're working on, and I'll talk you through how to fix it. Just put your phone there. Show me how it's broken. And these technologies didn't exist when this generation started in the workforce, so it's a little bit of a step. So you have to work with them and say, hey, let me show you how to do that. Let me write you an SOP maybe for how to use FaceTime so that you can help troubleshoot that device when support is hours away. You're in Montana and support's in Utah, right? Gen X, oh my gosh, prefers the phone call. Used to have this telephone in the kitchen with like a 20-foot long cord on it, and I'd sit on the other side of the room and talk on the phone all the time. I'm a Gen X. But also came in the age of email, right? So these are those folks that might send you an email, and they might send you another email, might send you a third email. I had to put a policy in at work that says after 2 emails, if it isn't sorted out, call. Don't keep trading emails 8 and 27 times. Call after the second one. Let's get everybody on the same page to deal with the fact that some people came of age during the age of email, and that's what makes them comfortable, and they do it. If miscommunication occurs, Gen X people are likely to pick up the phone call, especially if there's a policy, right? If it's possible, they might even go walk over to your desk and just talk and say, hey, I'd like to sort this out, right? They also embrace the whole video meeting thing pretty well. But just like baby boomers, they're gonna prefer a scheduled meeting to a video meeting or something ad hoc. Millennials, oh my gosh, came of age with texting and chatting. So they invented the chatting apps that companies are using today, you know, like Slack is one that people are using. So they might be the people who are leading communication in the not so distant future. They might be the ones that are currently the biggest generation in the workforce, driving what communication looks like tomorrow. They're the only generation that rates chatting as one of the top ways to communicate at work. Send me a Teams message. I don't want an email. I don't want a text. Chat. I don't want to call. I don't want to talk to you at all. In fact, send me a text to see if you can call. That's these guys, right? And they exist. That's a reality. It might be in a meeting, and calling is a terrible thing. So yeah, send me a text, see if I can call. They acknowledge the value of video meetings. However, these are the folks that are going to keep their cameras off. And it's not just because it causes the Teams meeting to stutter and give you bad performance. They're going to keep it off because I really want to be on camera. They might also use the chat window in a meeting to put their 2 cents out, as opposed to raising their hand and coming on camera and saying, hey, I've got a thing. What about? These are the folks that are the texters and the chatters. Gen Z. Oddly enough, they're a lot like baby boomers when it comes to digital communication, right? They have similar preferences. They love face-to-face meetings. We're going to collaborate. We're going to walk out of Starbucks together. We're going to have face-to-face meetings. Let's get together and let's talk about it. Let's schedule that and be there tomorrow. Totally. One of the biggest differences between them and baby boomers, though, is grew up comfortable with technology. So FaceTime, they're there. How to use your cell phone to get help troubleshooting. Somebody's in Montana and somebody's in Utah. This is what I'm showing. They're there. Understand. They came of age with a phone in their hand. I was one of the terrible parents to let my daughter have a phone until she was 13. Doesn't, to this day, hasn't forgiven me for it. But they came of age with a phone in their hand and they know how to do it. So communication, don't overthink it. Trust yourself, but stop and remember that we don't all come from the same place. Maybe we're listening to this and we're not able to see the speaker. So stop and say, this is what it looks like. This is who's talking to you today. Maybe people have different communication styles. Maybe they're introverts and extroverts. Maybe they need to know ahead of time so they can plan for what they want to say. Maybe people are different generations. Maybe they need the communication to be tailored to a certain medium. I like video chatting. I like text chatting. I like emails. I like phone calls. How do we communicate with each generation in the workforce to make sure that they can hear the message? So that they say the medium is the message. Well, this is one of those times when, because we're looking at how do we make sure that everybody is hearing what they need to hear. It doesn't do any good if the machine's fixed and nobody knows about it. Well, I didn't tell the person who called it in because they went home for the day, and their boss did too. I was working late, and so I figured they'll figure it out. I mean, it's there. They can turn it on tomorrow and check and see if it's fixed. Often, end users don't. They don't know the status of their device, and so it's down for another day, and they call at the end of the day and say, hey, are you ever coming back to fix that machine? And heck yeah, it was fixed yesterday. Why didn't you use it today? Nobody told me it was fixed. Communication. Maybe leave a note. Maybe text them in the morning. Is it still fixed? Maybe FaceTime them. But how do we make sure that we're communicating effectively so that as service professionals, we can support modern healthcare? We can support those caregivers taking care of our neighbors. And they know that the devices are repaired, and they know that they can trust the device. It's not going to break again. You didn't just baling wire and bubblegum tape fix it. Instead, oh, I found it was not doing this. That's controlled by this component. This component, we got a new one from the manufacturer, and we installed it per the instructions, and it's going to work now. Oh, well, now I can trust my equipment. So communication, we're trying to make sure that we're not only addressing interpersonal, but also we're building trust with the devices. We're enabling modern medicine to pursue. When you're talking with different generations, do in fact consider how they like to communicate. Do they love email? Do they love texting? Do they like FaceTime? make sure that everybody has not only introvert versus extrovert communication preferences taken into consideration, but also some generational preferences taken in as well. Be open to change. If miscommunication happens, own it. I was in a class yesterday, and the biggest thing for communication was just get feedback. So everybody's still with me. We're all understanding what this is about. And you might get somebody that raises their hand and says, heck no, Mike, what the heck were you talking about 4 slides ago? I'll wait till the end. Well, we're at least going to catch it before you walk out and go, that was a waste of time. But let's make sure that we're soliciting feedback, that we make sure everybody understands. And if you don't, raise your hand and ask a question. Speak to your leader. Say, hey, I got a question. I don't understand why. I don't understand a lot of stuff. I ask all kinds of questions. My boss probably complains about how many questions I ask. But that's how I learn about things like Medicare reimburses at a different rate. So what's the impact of a device being down? Well, it's stress on the caregiver, because they have to tell the patients, I'm sorry, our device is broken. I know you fasted for 24 hours, but go home, eat a sandwich, and then fast for 24 more hours and come back tomorrow. That's a heck of a message to have to deliver. So stress on the caregiver, stress on the finances, right? The machine isn't there and it's not in production, then how's that impacting the organization? There are devices that it's, $1,000 per use of revenue coming in the door. I think the last I read, it was a normal patient that has a cardiac cath procedure. From the time they walk into the door to the time they leave, it's $65,000 in revenue for a cardiac cath procedure. And you get like 3 or 4 of those a day out of a good cath lab. So understanding the revenue model that's behind some of your stuff, ask questions. You have to ask to get those numbers. You have to get your teams to start asking their stakeholders, hey, so when this is broken, how does it impact you? There's all kinds of KPIs, mean time between failures, how long does it take to return it to service? What's the patient impact? Maybe that's a better KPI we should think about as an organization, as a field. What's the patient impact of something being broke? Well, we don't know if we don't communicate. If your team member goes and they fix it and they don't say, so I know it was broken for 2 days, how many patients did that impact? Then they don't have a stake in the game with that stakeholder. They don't have any vested interest to get it fixed faster. They don't understand how they are part of the big mechanism that is modern healthcare. So when you have new young people starting to work for you and they're fresh to healthcare, get them to ask questions. Make sure that those miscommunications are cleared up, but also so they understand what the impact of a broken device or a device taken out of service for a PM. Oh, but now something else broke. I got to fix that. Well, the PM it was scheduled down. Don't skip the PM, go do the thing that's broken, and then come back and the PM was down all day, but all those patients didn't get seen. Let them know I'm going to have to cancel the PM, or say I know it's broken, that stinks, but I've got a PM already scheduled for today. I'm going to do my PM instead. Communication, right? What's the patient impact? And making sure that they understand what's going on in that Teams meeting that you're having on Tuesdays. They knew what the agenda was going to be tomorrow. So talk a little bit about soft skills. Make sure that you're either hiring the right people to come in the door or you're training up the ones you have. And we're only doing half of the people by 2025. So half of the people can be new. They can be the right ones walking in the door. But the other half, we're going to need to train up. We're going to need to make sure that they're comfortable talking to physicians. They're going to be comfortable talking to stakeholders. They're going to be comfortable talking to security. Maybe we were having a problem with machines being broken because, I had a site once where they had portable X-ray units and they broke about every week. This is a machine that shouldn't break every week. And so they ended up talking to security and saying, what's going on with this machine? Turns out on the midnight shift between 12 and like 3 in the morning, There were techs that were sitting on top of the x-ray machine, pushing the go button and racing them down the hall. What was the question? Yeah, see? So being able to talk to security, it's important. That's how you get that camera footage to find out what's going on. Leadership, as a leader, as somebody who may have a leader and need to say, this is what works well. If you're my leader, you need to give me this kind of feedback and recognition. It's about leadership. It's not management. You manage things. You do not manage people. You want to coach them and help them forward. But if you're trying to manage people, well, then you're embracing a leadership style that was put in place in the beginning of last century. And because the talent has changed, the way that we lead people has had to change as well. And then thinking about different generations in the workplace. We've got some traditionalists, baby boomers, Gen X, millennials, Gen Z, different generations in the workplace, and they all like to communicate differently. Maybe they can figure out, I've got a work order, I'm going to download my work orders in the morning and I'm going to be good. But if something comes in during the day, how are you going to let me know I'm out on the floor? Do I want to call? Do I want to text? Do I want the CMMS to just send me an email? Make sure that we're communicating with our staff so we can do our jobs effectively and we can keep the equipment there for access to care for our neighbors.